Joining us now is psychotherapist Robi Ludwig. Robi, thank you so much for being with us.
Thank you for having me.
So first off, can you walk us through what exactly this disorder is and how it differs from just general defiant behavior?
Yeah, so it's really normal for kids to defy adults. That can happen a lot. But with oppositional defiant disorder, it's a pattern of volatile behavior that even when parents try to make an intervention, it doesn't really work. So they can be mean, they can be physical, and they just don't respond to any limit setting. And this is not only seen within the home, but this is seen outside of the home as well, which is why professionals really need to get involved.
So when it comes to the normal disobedience versus this diagnosis, which is part of like the diagnostic manual for psychologists, right? Yeah. What are some of the external factors that might contribute?
So, of course, genetics for oppositional defiant disorder, and sometimes the way a parent reacts. So if a parent is super anxious, super nervous, super angry, maybe like highly involved and highly reactive, that's when a child also can respond to that parent just acting over the top. Kids do respond to how their parents make these interventions. That's why it's so important for parents to take that time out, because you are a role model for your child. So if you behave in a calm but firm way, your child will understand that you're protecting them, they know they've overstepped, and you're helping them internalize rules that they really need to learn from parents and the world around them.
To that end, like children sort of absorbing things they see in their parents, what are some tips for dealing with a defiant child?
So, I mean, in terms of just defiance across the board, including someone who has a disorder, you want to understand where it's coming from. What are their triggers? What do you know about your child? Did they not get enough sleep? Are they feeling overwhelmed? Is it an indication of a mental health issue like depression or anxiety? And you want to speak to how your child can do better. Like, I know you can do better. Would you like to try that again? So you give them an out and also send the message their behavior isn't right, but you know that they are in there and they have an inner wisdom that they can tap into.
Like they are good, but their behavior in that moment is not good. This is so tricky as a parent. I've been through a lot with my kids, right, where you just want to scream back.
Oh, yeah.
When a kid is being defiant and yelling at you, you just want to, or at least I want to raise my voice.
We've all been there where we have not acted ideal and we scream back, but we can come back and say, you know what? I wanted to say that I wish I handled it differently. I wish I was able to say, can you share your emotions in a way that's kinder? Can we restart again? I want to hear more about what was upsetting you. Because you have to remember, for the parents, we are the people that they can show their worst self to, because they're not going to stop being loved. So sometimes they need that place to just let it all out. But we can say, can you do it better? Can you do it nicer?
I love that. And sometimes the expression of emotion is them saying, I trust you, I feel comfortable with you.
I love you, I know you won't leave me.
Yeah. All right, Dr. Robi Ludwig, always learn something from you.
Oh, thank you.
Thank you so much. And we got a lot more news ahead, so don't go anywhere.
You're watching NBC News Daily.